Hello students, welcome to Easy Nurse, where nursing education made easy. In this session, we will discuss about gynecology. So, as your exams are coming, gynecology plays a very important role in midwifery because it is also attached with the midwifery and gynecology. The exams are together, but I will separately focus on gynecology because sometimes you will just ignore the gynecology and you will go for the midwifery part. It is also very important. Okay, so in this session I'm going to discuss the most important topics that will cover most of your syllabus. Okay, and if after having the live also, after seeing the live also, if you feel some difficulty, if you feel some queries, or if you feel the explanation is much needed, you can go in the apps. So I will not explain very briefly, but I will give you the idea of the answers so that by on your own you can write the answers in the exam. So let's start the video. So our first question is, the first topic is the development of female sex organs and role of hormones in sexuality during puberty. So what is puberty? Puberty is a stage when a girl's body will become mature. It will start hitting the puberty because of the hormones, and there will be some physical hormonal changes inside the human body, okay, of a female. So there are organ changes, there are some changes of the behavior, mentality, voice, okay, body structure and all. So let's see. So first is female sex organ. Now as we know, there are two types of female sex organ, internal and external. In internal we can see ovaries, we can see fallopian tube, uterus, vagina, cervix and all. Okay, but in the outer side we can see what else is there? We can see mons pubis, then clitoris, vaginal orifice, urinal orifice, we can see labia majora, labia minora, okay, and also along with the perineum part. Okay, so this is all about the external part. Along with that, there are some supportive organs which are not main female sex organs or female reproductive organs. That includes breast, okay, and or mammary gland. Okay, so these are actually the main part of the female sex organs. Now the ovaries will start producing eggs in the sense ovum. Okay, in medical term we will call it as ovum. It will start producing ovum and the menstrual cycle will begin. Okay, this is the main change. Along with the fallopian tubes will start moving the ovum towards the uterus. Then the uterus will be largened, cervix will be widened, and vagina will also become flexible during the period. And there the main thing that will start in the puberty of female is the menstruation cycle. So what is menstruation cycle? So it is actually the shedding of the uterine wall along with the unwanted or unfiltered or waste blood, mucus and all. Okay, so why it happened? See, in the female, when they will start producing, the ovaries will start producing ovum. It will, after that, it will start getting mature. But when the body will see that there is no place for the, place for what it called conciseness, or there is no sperm is involving in the procedure at that time, or the woman is not getting actually pregnant, at that time what it will do? It will again increase the menstruation hormones, then it will start producing the menstruation blood. Okay, so that all happened. Then ovarian hormones like estrogen. So in the puberty stage, the estrogen hormone will increase to producing, which will increase which will helps to increase the breast development, widening the hip areas. Okay, especially hip area act a very important role in women because bearing the child, okay, the weight of the child, the placenta, amniotic fluid, it will be very weight, right? So it have a weight. So to bear that, our hips will also start widening. Then pubic and axillary hair will grow as a sign of the puberty. Then progesterone also helps perhaps in prepares endometrium for pregnancy. As I told, like the ovum will start releasing the progesterone until and unless the invasion of the zygote is happening in the uterus. It will prepare the endometrium layer of the uterus. Okay, so the fetus can be invade over there. Okay, it will thicken the endometrium layer of uterus, and it also regulates the menstrual cycle. Okay, so these both hormones are very important. Then pituitary hormone. Two types of pituitary hormones are there: luteinizing hormone and follicle stimulating hormone. So what follicle stimulating hormone will do? Follicle stimulating hormone will helps to increase or to increase the growth of the ovum. Okay, so the luteinizing hormone triggers the ovulation. Okay, it will trigger the ovaries for the ovulation to produce the ovums, or we call it as eggs. Okay, and follicle stimulating hormone will stimulate the follicle growth. Okay, when from ovum it is becoming follicles. Okay, then it will, the follicle stimulating hormone will helps to make them growth, and estrogen production also it will increase. Next, impact. So what is the actual effect of this puberty or sexual hormones during the hormones have problem? Sorry. Okay, so what is the impact or effect of this hormone have on the human body? So it will helps to development of the secondary sexual characteristics, and it also influence the sexual behavior and reproductive function of the woman. Okay, so these are the changes in the human body because of the puberty in females. Next is premenstrual syndrome. So what is premenstrual syndrome? See, in sometimes what happened because of the the environment, the lifestyle and the genetic causes, sometimes what happened before the proper age of getting puberty, the girl will have their menstruation cycle. Okay, so the physical, emotional and behavioral symptoms before the menstruation, so they will particularly not actually have the menstruation, but the symptoms, physical, emotional and behavioral symptoms they will have before actual menstruation. Okay, so what is the reason of that? So the reason include because of the hormonal fluctuation of estrogen and progesterone hormone. Okay, and also because of the serotonin level changes. So when these two hormones have changed their level of production, or they produce in excessive amount during the childhood, then what happened, before having the menstruation only, the child will have the physical, emotional and behavioral symptoms of the menstruation. And serotonin is also involved in this cause. Okay, so what are the features or what are the symptoms of this premenstrual syndrome? It includes mood swings and irritability, which is very common in teenage and all. Then bloating of the abdomen, breast tenderness or hardness of the breast, headaches and fatigues. Okay, next we have is nursing management. So as a nurse, how we can manage this condition? First, we have to give the health education and reassurance to the patient and the family member regarding the menstruation, what is actually menstruation, why this is happening, why the girl is having this kind of symptoms or this kind of physical appearance changes before the age of hitting the puberty. Okay, that we have to briefly explain, because it can sometimes produce some taboos and all, and sometimes the girl will not feel confident enough about their body language and all. Okay, so health education and reassurance is very much needed. Other than that, we can give them a balanced diet, low salt and low caffeine diet. Okay, then stress management such as relaxation and exercise. For the other part, the medication, the pain relievers and hormonal therapy, if the symptoms are very severe, we can provide to the patient with post-menstrual syndrome. Our next topic is dysmenorrhea, cryptomenorrhea and dysfunctional urinary bleeding. Okay, or urine bleeding. First one is dysmenorrhea. Okay, so what is dysmenorrhea? Dysmenorrhea actually means the painful menstruation. Okay, usually if it is a normal, it can have a cramp a little bit, but if it is excessive, it is not normal. Okay, if the pain is excessive, then it is non-normal, not normal. It is called as dysmenorrhea. Okay, then causes of strong uterine contraction, maybe during the menstruation period. If the person is having continuous contraction, uterine contraction, which is very sharp, then it can cause the dysmenorrhea. Okay, next is symptoms. So what are the symptoms of dysmenorrhea? So the symptoms are present such as lower abdominal cramps, back pain, nausea, vomiting, etc., loss of appetite and all. Okay, so see how we can manage it. We should not give always the pain reliever tablets, because this is not good. We should try to treat it properly. Okay, so we can give a hot water bag to relieve the pain, we can massage the area, okay, or we can give some Ayurvedic pain management tablet, so that it will be naturally, the pain will be reduced. And if the pain is very much, the patient is not able to respond, or the patient is not able to bear the pain, then we can see a doctor and give the proper medication as per the doctor's prescription. Okay, so this is about the dysmenorrhea. And see, nowadays dysmenorrhea you can see in many of the teenage. Okay, because especially the persons who have PCOD or PCOS, they suffer through this kind of menstruation cycle, painful menstruation cycle. Okay, next we will move on to the cryptomenorrhea. So what is cryptomenorrhea? It is actually the menstruation occurs internally, but the blood retained in the uterus. Okay, so what is happening, I will explain. So see, this is our uterus, right? Okay, this is our uterus, there is fallopian tubes, ovaries will be there. Okay, leave that. This is our uterus. After that there will be cervix, and this is the vagina. Okay, so see, sometimes what happened when the menstruation is happening, the shedding of the endometrium layer, will be there, and it will be start bleeding internally. But because of some because of some obstruction, it can be because of the cancer or tumor over there, or because of any kind of infection or a plug over there in the cervix or vagina, sometimes the blood will not come throughout. Okay, due to vaginal obstruction. It is called as cryptomenorrhea. So the symptoms may show amenorrhea with pelvic pain, which is absence of menstruation cycle with pelvic pain and abdominal swelling. Okay, so how we can treat it? We have to show it to the proper gynecologist. Okay, and we have to follow a proper diet plan, okay, with less spicy food and high fiber rich food. Okay, also the diet have to include the iron rich food, so the blood production will be more. Okay, the next one is dysfunctional uterine bleeding. Okay, so what is dysfunctional uterine bleeding? So it is an irregular, excessive or absence of menstrual bleeding. So it is very common nowadays because of the radiation, because of the pollution, and because of PCOD, PCOS patient also you can see. So what will happen is, see, in 2025 I am saying, okay, so a girl, she is having periods on January 25th to 31st. Now January month over, February also she got 26th February to 2nd of March. But in March month she will not have any period. April also she will not have any period. Then again just after that, in May month maybe she had her period. Okay, and it is for 10 days. Okay, it will be for 10 days. So this is called as dysfunctional uterine bleeding, where the menstruation cycle will not follow any kind of pattern, and sometimes the bleeding will be excessive and sometimes the bleeding will be very less. Like, as an example, I can say in a month, if a patient is having 3 to 5 days of menstruation, then it is fine. Okay, but for some patient, okay, who have this kind of problem, maybe in month they only have 2 days of menstruation. In between that also they don't have much bleeding, and sometimes they will have the bleeding, but it will be continued for 15 days. Okay, so this is the problem in that. Excuse me, guys. Okay, so that is called as dysfunctional uterine bleeding. Next is so what is that? So it is actually irregular and excessive or absent menstrual bleeding. So it is not linked to structural or organic pathology. Okay, it is not linked with any of that. And the common in adolescent and perimenopausal women in the sense, usually the woman will have 45, in between 45 to 50 age, they will stop menstruating. Okay, so before that, like from the age of 35 or 37, or maybe from 40 to 45 years of age, they will face this kind of thing. Okay, so this is called as dysfunctional uterine bleeding. The next is causes of infertility in males and females. So what is the definition of infertility? Okay, when a person is having continuous unprotected intercourse, after that also for 1 year continuously, if they don't conceive, then we will call it as infertility or infertile. Okay, there are some causes. It can be happen because of men, it can be because of women, or it can be because of both. Okay. So the main causes, the female causes of infertility is ovulation disorder in the sense PCOS, hormonal imbalance. Okay, then tubal blockage. What is tubal blockage? Tubal blockage is actually a big problem, why I say, and it is also sometimes life threatening, because when in the fallopian tube, the ovum will not able to pass through the fallopian tube, and if it will not go into the uterus, then there will be no invasion of the zygote and there will be no fetus, so the mother will not able to get pregnant. So this is a very huge cause, and due to that of due to PID and infection, okay, it can happen. Sometimes if that blockage will burst also, the woman can die. So it is a very huge problem. Other than that, endometriosis, uterine abnormalities such as fibroid or septum, if it is there, in that case also it can happen. Then cervical factors such as hostile mucus and stenosis. Okay, so these are the female causes of infertility. Now male causes. Main causes include low sperm count or poor motility or poor movement of the sperms. Then varicocele, which is enlarged or scrotal veins. Then infections such as mumps, orchitis and all. Then hormonal imbalance like low testosterone and all, and genetic factors such as Klinefelter syndrome. Okay, so these are the main causes of infertility in males and females. Next is artificial reproductive techniques. Okay, this is very common, became very common nowadays. Okay, so we have IVS, in vitro fertilization, ICSI, which is intracytoplasmic sperm injection, other assistive reproductive techniques, and crypto-reservation. Okay, also we have donor egg or donor sperm. So what is in vitro fertilization? In vitro fertilization is actually, first what we will do there, we will stimulate the ovaries of a female, then we will give the egg retrieval. Okay, then the fertilizer, we will collect the eggs, then we will fertilize it in the lab, we will prepare the embryo, and again we will transfer it directly to the uterus of the woman. Next is ICSI, okay, which is the sperm injection. It is a single sperm is directly injected into an egg used for a male infertility. Okay, there are the assistive sorry excuse me, so very sorry for that. Okay, so intrauterine devices, which is the sperm will place directly into the uterus for the invasion. Next is cryptoreservation, which is actually freezing of egg, sperms or embryos for future use. So what will happen? Sometimes the mother and the father or the couple will not, they don't want the child. If they don't want the child at that moment, like if a couple is there, okay, if a couple is there, okay, just think a couple is there, okay, a male and a female, a male and a female. Okay, so what will happen? They have a career, they don't want their child in 2025. Okay, but they have suspected that the man is getting old. The female is also having PCOS, PCOD problem. Maybe if future 2030, if they want to get a child, they will not able to get because of the infertility, and they have to go for the other artificial reproductive techniques, and it can be dangerous for both of their health. So what they will do? They will freeze their eggs and sperm for the future use. Okay, it is not actually the 5 years they can store. There is a particular time limit. Okay, just for the explanation I have said. Next is donor egg or donor sperm. Okay, sometimes what happen? The female is infertile. So the male they will use when the own gametes are unsuitable. Okay. So they will take the egg or the ovum from a donor, okay, and they will use to fertilize the sperm, and they will use the patient sperm to fertilize that ovum, and they will have a child. Same as for the sperm also. Okay, so that is called as donor egg and donor sperm. So these are the main artificial reproductive techniques. Also surrogacy happened, but surrogacy is in surrogacy what will happen is they will directly inject the sperm into the uterus or into they will collect the egg, they will inject one sperm in that particular ovum, and they will place the ovum inside the uterus of the woman. Okay, so that is all artificial reproductive technique means. Next is ethical and psychological issues in infertility treatment. So while doing the infertility treatment, there are some ethical and psychological issues are present. Which are those? The ethical issues in the ART or assisted reproductive technologies are donor anonymity, okay, which is protecting donor and recipient privacy. Then embryo storage, which is the decision about the unused embryos. ART access, in the ART access, what are the things we have to do? The fair availability across the social and economic groups. It have to be accessed by all of the groups, not the only the poor will not get and only the rich will get. It should not be there. Okay, next is psychological issues. Psychological issues such as emotional stress due to uncertainty and treatment side effect, then relationship strain, marital or parent conflicts, okay, parental conflicts or partner conflicts, and outcome anxiety, worry about treatment and success or failure. Okay, importance of counseling and support groups such as reduce emotional burden, helps in decision making, provides peer support and coping strategies. Okay, so these are ethical and psychological issues in infertility. Next we have is pelvic infection and pelvic inflammatory disease. Okay, so pelvic infections have different types such as vulvitis, vaginitis, okay, trichinosis, moniliasis. So we will discuss it separately. So what is vulvitis? Vulvitis, okay. So the inflammation and infection of vulva is called as vulvitis. Then vaginitis, inflammation of the vagina. Trichomoniasis is the parasitic vaginal infection. Moniliasis is the candidiasis, the fungal infection or yeast infection. Then metritis, it is actually called as the uterine inflammation. Then splangitis, it's a fallopian tube infection, and ophiritis is the ovary inflammation. Okay, so how we can manage this kind of infection and inflammatory diseases? The management include antibiotic treatment for the broad spectrum disease, antiviral, fungal and antiparasitic treatment, and creams for the bacterial, fungal and parasitic infections. The patient education is very much needed regarding the sex education and all, where we have to complete the treatment of the course regarding the safe sex practices and follow-up care. The pelvic inflammatory disease is actually the infection of upper genital tract such as uterus, fallopian tube and ovaries. The symptoms include pelvic pain, fever and vaginal discharge. So the management will be the same. Okay. Next we'll move on to the STIs or sexual transmitted infections in women and syndromic management. The common STIs or sexual transmitted disease include syphilis, gonorrhea, genital warts and HIV. The syphilis is because of the syphilis bacteria. This is painless ulcers and rashes over the genital areas. Gonorrhea, discharge and painful urination, okay, because of the gonorrhea. Then genital warts, this happened because of the HPV virus, okay, human papilloma virus, where the fleshy growth will be seen. Then HIV, flu-like illness and immune suppression. This all happened because of sexually transmitted infection or unprotected unsafe sex practices. Okay, then diagnosis. How we can diagnose this disease? We can go for clinical history, symptoms, lab tests such as blood, swab, PCR. Then we can also go for ELISA and all. Okay, so through this diagnosis we can able to assess the diseases. Syndromic management, we have to treat the base symptoms, combine the drugs for likely pathogens and partner treatment, education and follow-up for the better improvement. Next is pelvic tuberculosis. So what is pelvic tuberculosis? You are thinking how a tuberculosis can happen in the pelvis. See, when the tuberculosis happen and it is remain untreated or not properly treated, then when it will start hitting the pelvic organs, okay, it will start affecting the pelvic organ also, then we will call it as pelvic tuberculosis. So pathophysiology, how it happens, let's see. So the causative organism called as Mycobacterium tuberculosis infection affecting the pelvic organs. Example as uterus, fallopian tubes and ovaries. How it will spread? Through the hematogenous, spread through the blood, primarily from lung infection. It can also spread via the lymphatic system or direct extension. The target organ in the pelvis is fallopian tubes, endometrium, ovaries, peritoneum and all. Okay. So what are the clinical features? Okay, so the clinical features mainly will be infertility due to tubal blockage and endometrial damage. Menstrual irregularities such as amenorrhea, absence of menstruation and oligomenorrhea, scanty periods. Then pelvic pain like chronic dull lower abdominal or pelvic pain. Then other symptoms such as low-grade fever, weight loss, fatigue and vaginal discharge will be there in the pelvic tuberculosis. So this is the clinical features. So how we will manage it? We can manage it through the anti-tubercular therapy, monitoring adherence, patient education and supportive care. Okay, so this is about the pelvic tuberculosis. Next is benign tumors. Benign tumors include fibroid, cyst and polyps. What is fibroids? Fibroids actually the uterine muscle tumors. Okay, it's a benign growth of the muscular wall of the uterus, can vary in size from very small to large masses. Cyst, it is actually ovarian fluid filled sacs. Fluid filled sacs that develops on the inside of ovaries, common type functional cyst, demeroid cyst and endometriomas. Then polyps. What are polyps? Endometrial growth. There are small soft growths on the lining of the uterus. Endometrium usually begin but may rarely be precancerous. Okay. So the symptoms of fibroids includes heavy menstrual bleeding, or also called as menorrhagia, pelvic pain or pressure in the pelvic area, frequent urination and infertility in some cases. Cyst, how it will, what are the symptoms it will show? It will show the pelvic pain, abdominal bloating and swelling, pain during the intercourse and irregular periods. Whereas the polyps will show the irregular menstrual bleeding, bleeding between the periods and post-menstrual bleeding. Okay, so this is all about the fibroid, cyst and polyps. Next is management of malignant tumors of the reproductive tract. Okay, if the malignant tumors occur or cancerous tumor, how we will manage it? So we have to manage it through the observation. So how we will manage fibroid, cyst and polyps? The observation include for small asymptomatic cases, we have to go for regular monitoring with ultrasound or physical examination. The medication we can give hormonal therapies like birth control pills to control the symptoms, especially the cyst. Okay, then pain relievers or non-steroidal anti-inflammatory drug for the pain management. Also including this, we have to maintain a strict diet. Okay, low fat diet, high fiber diet, we have low fat low carbs diet, we have to give it to the patient. Okay, then surgery. So in the case of fibroids, we can go for myomectomy or hysterectomy for the fibroids, cystectomy for the ovarian cyst, polyectomy for the endometrium polyps, and laparoscopy or hysteroscopy used in some cases of fibroid, cyst or polyps. Okay, next is mastitis and breast abscess. Okay, so what is mastitis? Mastitis is actually inflammation of the breast tissue commonly occurring in the breastfeeding woman. Okay, so what is the causes? The causes are milk stasis or blocked milk duct, then bacterial infection, usually Staphylococcus aureus. Okay, so because of that this one can happen. Then symptoms such as breast pain and tenderness, redness, warmth and swelling, fever and chills and fatigue can be shown as symptoms of mastitis. There are two types: locational mastitis, which is related to the breastfeeding, and non-locational mastitis, which is very less common. Okay, then breast abscess, a localized collection of pus in the breast tissue, often complication of the untreated mastitis. So because of the mastitis, if it is remain untreated, breast abscess can happen. The causes mainly include the progression of mastitis and infection leading to pus formation. Okay, pus formation. Symptoms. The symptoms include localized painful lump, redness and swelling, fever and general illness, and pus drainage, sometimes spontaneous. Okay, so for mastitis, what is the management? To continue breastfeeding or expressing milk to relieve the engorgement, then warm compress before feeding, antibiotic as prescribed by the doctor, analgesic for pain relief, example as paracetamol, ibuprofen, and rest and increased fluid intake. Next, for breast abscess, antibiotic therapy, surgical drainage or the needle aspiration of the abscess, wound care and dressing, continue breastfeeding if it is possible unless the advised or otherwise. Okay, so in this case what happened, in the breast the pus will form, right? So in some cases doctor can say to stop breastfeeding. At that time the person can stop the breastfeeding, okay, or it will infect the child as well. Next is tumors of the breast, benign and malignant. So benign breast conditions include fibroadenoma and cyst. Fibroadenoma are actually non-cancerous solid breast tumor, smooth, firm, rubbery, movable lump, common in young women. Cysts include fluid-filled sacs in the breast, smooth, round, movable lumps, can be painful before the menstruation. Whereas the malignant breast condition or breast cancer include dimply hard, irregular shaped lump, fixed, immovable mass, skin changes like NG or puckering, nipple retraction, redness or orange peel texture, then possible nipple discharge. Okay, so these are all about the main conditions related to gynecology and problems that can happen related to reproductive system. So I hope you guys have very well understood. If you have any question, you can comment down below in the comment section. Do follow Easy Nurse. Stay tuned with us. See you in the next video. Till then, keep learning and keep exploring with Easy Nurse. Thank you.